All right, 1 month ago, I updated you all on COVID-19, the pandemic, and how it had been unfolding throughout the world and throughout the country. And now here we are on April 30th, and I thought I'd bring you another update as to where things have gone since then. This is a global map of case reports across the whole globe, and you're seeing the United States coming in as basically the highest number of cases of any country, over 1 million cases as of today, April 30th, and Europe coming in is basically the secondary epicenter, if you will, as far as case reports. Here's a table that I showed on March 25th, 5 weeks ago, and we were seeing world cases, global cases coming in at just about 500,000 with over 20,000 deaths. United States, just about 70,000 cases and only 1,000 deaths as of March 25th. A week later, I held an update where we saw those numbers move up to 777,000 cases worldwide, 160,000 in the United States. So in a 1 week period, we saw the United States cases go from 69 to 160,000. So almost a 100,000 person leap, and mortality tripled over that period. Now, of course, a lot of things have unfolded in the last month. So let's see exactly where we are as of today. April 30th, cases worldwide now over 3 million, and in the United States over 1 million. And the deaths, the mortality associated with COVID-19 has increased globally to a little over 250,000, and in the United States, we're now at just over 60,000 deaths nationally. So these are some of the numbers. Let me give you a quick summary. So March 30th, April 30th. Again, globally, we've moved from about 750,000 to now 3.2 million cases worldwide. And in the United States, we've moved from that number of 160,000 up now to over 1 million cases. So the COVID-19 pandemic by no means is behind us. We're still, as I'm sure you're aware, very immersed in this. These jumps in the last month represent 4-fold increase globally and almost a 7-fold increase nationally. I want to take a deeper look into some of these numbers. This is courtesy of Johns Hopkins. This is the global case reports broken down by some of the leading countries in terms of their case reports. You can see the line that is sort of standing out here among all these other countries is the United States here in green. That's about as straight of a line as I can draw. So just reinforcing that notion that COVID-19 is still well underway. Of course, the United States has over 300 million people, and we can expect that if we look at cases in an absolute number sense, that the United States, of course, is going to have the most cases of any other country, assuming this virus has started to make its way around the world. So it's useful to go from just raw case counts to actually population adjusted case counts. And now we start to see a little bit of a different picture unfold. This is cases per 100,000 people. And what you see is actually Spain and Belgium come in here at the top with the highest number of cases per unit population, per 100,000 people. And then we see Italy trailing in as third, and the United States not far behind Italy, sort of creeping up gradually, and probably in not too long may even eclipse the Italian country as the highest cases per unit population. Let's look at mortality per 100,000 people. Belgium here standing out, and Spain yet again, and Italy, but Belgium most so. And we see a different picture with respect to the United States. Of course, these numbers are going to all depend on the demographics of the population, the healthcare system, and so on and so forth, because now we're looking at mortality per 100,000. And the United States is coping better compared to the other states that we see here listed in this chart. Having said that, the United States also did see this pandemic arrive at a later stage in some of these countries, many of these European countries. So it may well be that case deaths per 100,000 go up in the United States in the coming weeks as some of the earlier people who contracted the virus grow into their later stages. But we'll have to keep tracking that. This is the United States map of COVID-19 that I showed again March 25th. 1 week later, we started to see this fill in with different shades as more states increase their case counts. And here on April 30th, we see quite a different map. Many new colors that have been added as case reports have increased around the country. California, Texas, some of the South, the Northeast, New York, Massachusetts, New Jersey, much higher case counts than we had previously seen. And you can also see Washington from the Northeast and other states as well. This is daily case counts that we basically see reported in the United States. New cases each day. This was what we saw in that first week that I updated everyone. This was week 2. And now 1 month later, we can see that cases are now much higher case counts than they were. However, there's also something, I think, a breath of fresh air in this graph, which is that this trajectory that we were seeing early on did not continue upwards, and that would have been not a good sign that we were flattening the curve. Actually, what you see here, it appears, is a flattening of the curve that we've been talking about so much. And this, of course, is not cumulative population, cumulative cases in the population. This is looking strictly at daily cases that are reported. So we're not seeing any more cases with each subsequent day being reported, more new cases. So I think that is a positive sign. It's a testament to the social distancing protocols that we've been taking, the mask wearing that people have been doing, and really the public mobilization and national mobilization in general that we've been seeing in response to COVID-19. Keep in mind that interventions, if successful, are anticlimactic. So we actually want to see fewer cases, fewer stories of people getting ill, fewer sensationalized news stories. The less climactic things we see on the news and throughout the country and the world, the better it is. So that's a testament to our public health interventions working. This is looking at new coronaviruses, same thing just reported by the New York Times, a little bit of a smoother, easier to visualize graph here. And the New York Times also presents this map that they update regularly, and this has not really changed over the last month. Still in New York, Southern California, Florida, some of these major cities still showing the highest case reports in any country. Now, this is also courtesy of the New York Times, and depending on where you're tuning in, I think this is a very illustrative series of graphs, which basically helps us to see with a snapshot where cases are still on the rise in terms of daily case reports. So this is newly reported cases. The top row here are states that are still showing pretty rapid increases in the newly reported cases. This is where the coronavirus is still really heavily afflicting and spreading. And you can see Massachusetts, Maryland, Indiana, North Carolina, these states really seeing impacts. Down here in the middle, these are some of the states where cases are languishing or turning downward a little bit. You can see New York and California listed, Washington, Texas, Missouri. States where cases are starting to drop, and in some cases quite precipitously, such as in Louisiana, such as Idaho, such as Ohio, are listed down here, Florida among them as well. So this is just, depending on where you're tuning in from, a useful snapshot to get an idea of as to how this virus is sort of materializing in different states. We can zoom in a little bit closer to some of the key states. New York has sort of been the epicenter for coronavirus cases in the United States, with over 300,000 cases. So about a third of national cases are in New York. And from this map of counties, you can see pretty quickly that most of these are not surprisingly centered around New York City, Long Island area. Moving into Massachusetts, where interestingly, there's actually more cases, 60,000, than in the state of California, where I am streaming from. You can see, not surprisingly here, that the cases are mostly concentrated around the city of Boston, the county that harbors the city of Boston. So let's turn to California. This is courtesy of the LA Times reporting. We saw these numbers in March. So this was 1 month ago, March 30th, Los Angeles, about 2,000 cases. Orange County, where I am, was about 464 cases. This is all, by the way, just the cases that are reported, the cases that we know about. So all these numbers, you have to keep that in mind. These are not concrete, set in stone. This is what we know. Not necessarily every case is getting reported. Some people are potentially not going to hospitals, and so on and so forth. Nonetheless, this was 1 month ago, the situation in California, and moving forward on to today, April 30th, we see a different picture. Southern California really sort of getting shaded in here as Los Angeles and neighboring counties see more cases. This is looking at the cumulative cases, about 50,000 now in the state, about 2,000 deaths. In Los Angeles, we see that in that 1 month period, cases increased from 2,500 to 23,000. So about a tenfold increase right here in Los Angeles in just that 1 month span of time. And again, that's partially going to be attributed to increased reporting, increased testing, more aggressive testing, but also due to inherent spread. And Orange County, we're seeing about a 5 or 6 fold increase here in the county of Orange. And you can just kind of see some of the other counties I've listed as well. I want to zoom in a little closer to California to sort of get an understanding as to how the story is unfolding here. You can see from this interesting table that was published in the LA Times that the total case counts and deaths are labeled, as well as population adjusted case counts and deaths. But in the middle here, we've got this interesting shading that shows you the story from March 1st to April 30th as to how new cases and when new cases have been emerging. So the areas, the counties where we see the shading mostly falling to the right, these are the counties where we're still seeing the coronavirus saga sort of unfold in real time with more cases concentrated in more recent time periods. And that, of course, includes Los Angeles, San Diego, Riverside, Orange, and San Bernardino. These are some of the more recent shaded areas. And we can also look at the per 100,000 case reports. So this is kind of giving us a little bit of an idea as to the density, if you will, of coronavirus within the populations of these different counties. And a slightly different story emerges. You see Los Angeles coming in as sort of the most densely, most dense in terms of the virus, and Riverside, but also San Francisco and San Mateo. If you look at the cases in the population in a city or a county like Los Angeles, which is there's the most cases per 100,000 people, you do the simple math, you get to a number of about 0.23% of people in LA have coronavirus or would be considered cases. So just to give you a little bit of a sense as to, you know, how many cases are out there in the population when you're going out to the grocery store, walking around in public, it's about 1 in every 2,000 people if you're living in Los Angeles. So hopefully that gives you a little bit of a sense as to the extent of the outbreak, and helps to quell some of your anxiety and fears. It doesn't mean that every time you step out of the door, you're going to be bumping into somebody with COVID-19. Certainly not the case. However, keep in mind, if you're going to the grocery store, you know, you might bump into or cross paths with 50 people or 100 people. And if you're doing that grocery shopping once or twice a week, interacting with other people, you can see how that number can quickly increase, and the odds of you contacting somebody who may have coronavirus can actually go up pretty quickly. So don't take that number too lightly, and do keep in mind the importance of social distancing, wearing masks, and so on. And this is looking at mortality per 100,000 people. You can see that the story also is a little bit different from county to county. We're seeing the highest mortality per 100,000 up in LA and Riverside. But again, these numbers are not set in stone. And to some extent, this is going to reflect the saturation of hospitals and their ability to handle more and treat adequately more individuals who come in seeking medical attention, and so on and so forth. And the case fatality rate in Los Angeles, to take one example, is about 4.5%, which is a little under the national average. This is cumulative cases, how they've been mounting over the last few months, the last couple months. And again, it's highlighting the fact that we are not done with coronavirus. We're not past COVID-19. It is not behind us. We are still in full pandemic mode, and this is a straight line. We're still seeing cumulative cases increase in a pretty linear fashion. Now, mortality rate. Let's talk about mortality rate. As I showed last month, mortality rate is not a fixed number. It's not a single number, but it does change over time, depending on how the virus evolves, who it afflicts. It changes not only over time, but also over space. So different countries are going to have different mortality rates, again, depending on the age and demographics of their population, how aggressively testing is being conducted, how the healthcare system in that country is functioning. So you're going to get a variety of different mortality rates. In the present context, we've seen a wide range of mortality rates ranging from less than 1% in places like South Korea, early on in Finland and Australia, but all the way up to 10% and more in areas like Italy and Belgium. Globally, we can get a crude idea of case fatality rate by simply looking at cases and fatalities, and we get about a 7.1% mortality rate globally. And in the United States, we've got about a 5.8% crude mortality rate. And again, that is going to continue to change over time as this virus continues to make waves around the country and infect different populations, different groups. This is what rate of hospitalization records show in terms of the age and hospital admissions for COVID-19. As we've all come to learn, people who are 75, 85 in their older age are showing higher case fatality rates and also higher hospital admissions. But by no means are people in their 50s and 60s exempt, of course, from this, and same goes for people younger than 50 in their 18 to 49 range. However, the case fatality rate and the hospitalization rate is substantially lower as you get into younger age groups. And a positive message is that very few, a very low percentage of children and infants are getting hospitalized and dying from COVID-19. So if there's any glimmer of light in this whole catastrophe, it's that the children thus far have mostly been safe. There's a really interesting article that just was published in the New England Journal of Medicine, a really prestigious journal that I wanted to bring to your attention, titled Asymptomatic Transmission, the Achilles heel of Current Strategies to Control COVID-19. So let's take a look, as this paper does, at some differences between the 2003 SARS epidemic in Asia and the COVID-19 outbreak that has now become pandemic and global. As the article talks about, viral shedding is mostly in the lower respiratory system for the SARS epidemic, whereas in the case of COVID-19, we're actually seeing high shedding in the upper respiratory tract, which has, of course, implications for coughing and sneezing and transmitting this virus around. Also, mostly post-symptomatic viral shedding was the case for the SARS epidemic. Most of the time, people who were infected also had symptoms, were showing symptoms. In the case of COVID-19, the viral load, which is basically how much virus you have in your system, tends to peak about 5 days earlier. So people are actually having a high load of virus and also a high shedding of virus before they're even symptomatic in many cases. So we see pre-symptomatic carriers with the case of COVID-19, and I'll talk about in just a moment. Potentially a couple of days, a few days before you ever get symptoms, you might actually be at the peak of your viral load, have more virus in your system than at any other point. So extremely important implications for shedding and spreading the virus that are not very readily detectable and not very easily screenable. So symptoms-based detection in the case of the SARS epidemic was actually a pretty effective way of screening and detecting the virus in the population. But as I just mentioned, pre-symptomatic carriers, asymptomatic carriers makes symptom-based screening a lot more difficult. You can't simply wait for somebody to show symptoms before you sort of make a judgment as to whether or not they are infected. And consequently, these differences have translated to the fact that in the SARS epidemic, over an 8-month period, there was basically only 8,000, a little over 8,000 cases in just a very limited area. This was in Asia. And of course, in the case of COVID-19, we're seeing within a 5-month period COVID breakout substantially, infecting over 3 million people and still rapidly growing. Let's take a little bit of a closer look at this paper. They actually have a study population. This was a nursing facility, a skilled nursing facility, where an outbreak of took place of 76 residents. 48 of them tested positive for COVID-19. Now, of the 48 that tested positive in this small outbreak, this cluster, 56% of those people testing positive did not have symptoms at the time of the test. They were asymptomatic, later termed pre-symptomatic patients because they ultimately did develop symptoms. But interestingly, the median amount of days before they developed those symptoms was four days before these positive infected patients actually developed symptoms. So some people even later, some people earlier, but it basically just drives home that message that you can actually test positive and be infected with COVID-19 with a high viral load of COVID-19 and not even be symptomatic for days. And in some cases, there could potentially be an asymptomatic carrier and never show symptoms. However, still able to spread that virus around through the respiratory tract. So another just fact I found in this paper that I just thought was worth sharing, since many of us do have people in, grandparents that are in nursing homes and so on. 10% of nursing homes in the U.S. now report cases of COVID-19. So I'm just driving home the importance of taking precautions for people living in nursing. So wearing masks, I wanted to talk about why the CDC reversal of the recommendation to wear a mask. When this whole epidemic, this whole pandemic got started, wearing a mask was not really recommended. It was actually suggested and indicated that masks were not effective. I want to stress that the physics of that has not changed. These masks that you buy at Home Depot, these you wear maybe mowing the lawn and so on, are not very effective at protecting a healthy person from getting COVID-19. Very fine particles can still easily penetrate the mask. The reason for the reversal is pretty much twofold. And the first reason is at the outset of this virus, it was important that healthcare practitioners, nurses, doctors, people on the front lines of the pandemic had masks, and it was important to ensure that the population didn't run and basically drain the supply of masks that should otherwise be going to hospitals. Because while a mask might not be very important in protecting me from a sick person, if I'm actively working with a sick patient and I can easily get the bodily fluid of that individual onto me, then it's imperative that I have a mask. So for medical practitioners, nurses, doctors, masks are necessary, and the priority was to make sure they can keep those masks rather than having them go to people where they're not really effective. They're not going to be effective if you're walking in a grocery store in terms of keeping you healthy. Now, where masks are effective is from keeping others healthy if you are the one who has the infection, because coughing, sneezing, you expel droplets, which can then get respired by somebody else. So it's important, if you have the virus, to wear a mask. Now, the reason of the reversal and now telling the whole population, please do wear masks, is this evidence as time has gone on that pre-symptomatic transmission is very dominant. In fact, as I'll mention in a moment, upwards of 40 or 50% of cases today are estimated to have been transmitted by and arisen due to pre-symptomatic or asymptomatic carriers. So discovering the important role that people who don't necessarily have symptoms but are infected have in transmitting this virus to other people basically drove home the importance of basically having everybody treat themselves as if they are infected. So assume you have the virus, wear a mask, make sure that you are covered up so that you don't transmit the virus. So again, the sort of idea that, if you don't have symptoms, then you're fine is not the case. So it's more cautious to wear a mask and have everyone assume they have the virus, and therefore we can in fact effectively use masks to prevent the spread of this virus. So Do employ social distancing measures, and also don't forget your mask, whether it's homemade or bought at Home Depot or somewhere else, when you go to the grocery store or engage with others. So the take-home messages from this talk, basically, as I mentioned a second ago, 20 to 50% of people with COVID-19 are unaware that they have the virus. Estimated that people with no symptoms are actually the source of 44% of cases. Of course, this is an estimate, but we can say that, hey, if it's 30 or 40 or 50 or 60%, that's a lot of people, a high percentage of people who are contributing to the spread of the virus and not even knowing they were infected, or maybe just not for a few days. So key tips: maintain your social distancing, get tested if you have symptoms, and wear a mask in public. Thanks, stay healthy. Please visit these resources if you want more information. CDC, World Health Organization, great resources to continue to learn about COVID-19. The New York Times has also been a very helpful resource, along with the LA Times and other media outlets. Thank you so much. Don't forget to tune in live next time on my Instagram, dr.shahirmasri. I'll see you then.